Hello viewers, welcome to Learning Lane. Today we are going to see diabetes mellitus. It's a name we've all heard, but its reach extends further than many realize. Did you know that nearly 500 million adults worldwide are living with this chronic condition? That's like the entire population of the European Union. These numbers are even more alarming when we consider that diabetes is a leading cause of heart disease, stroke, blindness, kidney failure, and lower limb amputations. Clearly, understanding and managing diabetes is not just a personal health concern, but a global imperative. The good news is that while diabetes is a serious condition, it is manageable. By understanding its causes, recognizing its symptoms, and embracing healthy lifestyle choices, we can significantly reduce our risk and live full, vibrant lives. Let's delve deeper into the world of diabetes, separating fact from fiction and empowering ourselves with knowledge. At its core, diabetes is a disorder of how our bodies use glucose, a type of sugar that serves as our primary energy source. Imagine your cells as bustling factories, and glucose as the fuel that keeps them running. This fuel is delivered through our bloodstream, but it needs a special key to enter the cell's insulin. Insulin is a hormone produced by the pancreas, an organ located behind the stomach. In diabetes, this intricate system falters. There are two main types, type 1 and type 2 diabetes. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This means the body can't produce its own insulin, requiring daily insulin injections or infusions to survive. Type 2 diabetes, on the other hand, is characterized by insulin resistance. Here, the pancreas produces insulin, but the body's cells don't respond to it properly. The glucose can't enter the cells effectively, leading to a buildup of sugar in the bloodstream. This type of diabetes is often linked to lifestyle factors like obesity, physical inactivity, and unhealthy diets. Understanding these different types is crucial, as they dictate the course of treatment and management. But regardless of the type, the common thread is the disruption of the body's delicate glucose balance, with potentially serious consequences if left unaddressed. While genetics and family history play a role in both types of diabetes, there are a number of surprising risk factors that extend beyond our genes. For instance, certain viral infections, particularly in childhood, have been linked to an increased risk of developing type 1 diabetes. These include viruses like rubella, Coxsackie virus, and cytomegalovirus, highlighting the complex interplay between our immune system and this chronic condition. When it comes to type 2 diabetes, the risk factors extend beyond diet and exercise. One surprising culprit is sleep deprivation. Chronic lack of sleep disrupts our hormonal balance, leading to increased insulin resistance and higher blood sugar levels. Similarly, stress, often an unwelcome companion in our fast-paced lives, triggers the release of hormones like cortisol, which can also contribute to insulin resistance. Even certain medications like steroids used to treat inflammatory conditions can increase the risk of developing type 2 diabetes. This emphasizes the importance of open communication with healthcare providers about our medical history, lifestyle habits, and any medications we are taking. By understanding these surprising risk factors, we can make informed choices to mitigate our risk and prioritize our long-term health. Diabetes is often called a silent killer because many people experience few or no symptoms, especially in the early stages. This makes regular medical checkups crucial, especially if you have any risk factors for diabetes. Early detection is key to preventing or delaying serious complications. However, there are some telltale signs that should never be ignored. Frequent urination, especially at night, is a common symptom. This occurs because the body tries to get rid of the excess sugar in the blood through urine. Increased thirst is another red flag, as high blood sugar draws water from the body's tissues, leading to dehydration. Unexplained weight loss, even when you haven't made any changes to your diet or exercise routine, can be a sign of diabetes. This happens because the body isn't able to use glucose efficiently for energy. Other symptoms include increased hunger, fatigue, blurry vision, slow-healing sores, and frequent infections. If you experience any of these symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment. So, how is diabetes treated? The treatment typically involves a combination of lifestyle modifications and medication. Lifestyle modifications include a healthy diet, regular physical activity, and weight management. Medications used to treat diabetes include metformin, sulfonylureas, and insulin. But here's a promising fact. Researchers are currently exploring new treatments, such as stem cell therapy and immunotherapy, which may offer new hope for people living with diabetes. Make sure to subscribe for more videos. Thank you for watching.